Okay, because we're going to be talking about all things in the medial compartment, we're talking about treating them effectively and also safely. So we're going to move up the chain away from the soleus, working in the deep compartment of tibialis posterior and flexor dig. Really important muscle. Obviously biomechanically, it helps control the foot in the toe-off phase when we're running, so it is important. But it's one of those deep muscles, and it's one of those muscles obviously trying to get access to is difficult in some clients. So I'm going to show you the way that I go about it, once again effectively and safely. So it is so important that it's comfortable for you, but it's also comfortable for your clients as well. So here we go about it. So as in every area that I address, we're obviously going to use some really broad stroking just to get the area used to the contact for a start. The bony anatomy that we need to be mindful of is our tibia here. So obviously everything that we do will be on the medial surface of that. So we're moving away from that tibia. Now, the trigger points for tibialis posterior and for flexor dig are clustered together in this region up in this area here, okay? So once again, it's a cluster area, so we can actually treat this area quite effectively all in one. So this is how we go about it. So we'll prepare the area, going to come in with that broad forearm again, okay, making sure that you're not putting any pressure whatsoever onto the bone or the tibia itself. You can bring the foot just slightly off the table like so, okay, and then I can just slowly and softly sink into the tissue, okay. Now straight away you're going to get feedback from your client depending on how tight they are and also how sensitive it is in this area. So if they haven't had work in this area, you have to go slow, okay. So for today I'm working through for James, and he's not used to a lot of deep pressure through this area, so we've got to be mindful of him. So the first area I come up to is probably in and around that flexor dig. Once again, I'm sinking in there, slightly pushing the gastro out of the way, and then pushing in towards more medially, just into that little septum there. And you can probably feel that, James. Is that comfortable? Too much?
Yeah, that's good.
No? That's okay, good. That's good. So it is important that you check with them, okay? It absolutely 100%. All right, now that we're in that area, what I like to do is obviously sit, and then we can just slowly move the foot up and down. And I'm just engaging the tissue, and it doesn't need to be huge movements. It's just small movements while we work the tissue itself. And then you'll finally feel, you just be able to sink in that little bit more, that little bit more. The area will start to disperse. They may get a referral down their leg into their foot. May refer up sometimes, believe it or not. It's different for different people. Okay, that moves out, and then I can just move up a little bit further, and then I can sink into that tissue, and now I'm into tib post now. And I can sit here all day because I'm comfortable. There's no pressure on my shoulder, no pressure on my elbows. I'm not using my hands. Very safe, very effective. And then I'm just waiting for the tissue just to disperse. It's quite simple, you get used to it. There it is, that's it, that's good. Just move a little bit more. And then we come out the same way we go in, okay? Nice and softly, like so. All right guys, so that's flexor dig and tibialis posterior.